Hello and welcome to the program Healthy Living. My name is Ifeoma Igwe-Okafor. And today on the program, we want to look at occupational therapy. You know, oftentimes we go to the hospital without knowing exactly who to see and for what reason we should be seeing a particular consultant, as the case may be. My guest today is Victoria Amo. She is an occupational therapist and, of course, President, Nigeria Association of Occupational Therapists. And, of course, she's also a medical rehabilitation therapist, a board of Nigeria member. You're welcome to the program, madam.
Thank you very much.
So when we say occupational therapy, what exactly are we talking about?
Occupational therapy is a health profession that looks at the arts and science of occupying individuals. How do we occupy individuals? Daily, we look at activities of daily living, we look at occupying individuals. When you wake up in the morning, the first thing you do is take your bath, brush your teeth. Those are the things that you do, dress yourself. Those are the things that you do that helps to occupy you as an individual. So occupational therapist is the science and art of doing activities of daily living that individuals do every day. But when there is a disability, when there is a disease state, the disease state is if somebody has CVA, stroke, if a child has mental retardation, if somebody has traumatic brain injury, the person will be bedbound. Somebody has fracture, the person will be bedbound for weeks. So the occupational therapist is the person that helps this individual to be able to occupy themselves with the things that they usually do. Because we have come to realize that when people don't get occupied with the things that they always do, there tends to be some psychosocial issues present. You find sometimes people become depressed. You find sometimes people are not motivated. And we have found that in Nigeria especially, when someone has a disease state and is hospitalized, or I keep saying stroke because that's a classical thing that apparently people die from stroke, not from the disease state, but from inability to get the adequate rehabilitation that will help bring them back to their normal state. If somebody is a bubbly human being, goes to work, dresses himself, after work has his leisure, and then the person comes down with stroke or any kind of disease, and the person cannot do those things that they usually do, you find that those persons will come down, will get depressed, and from the depression, they might even die. So occupational therapy is very vital. It's a very vital part of rehabilitation in the hospital. All hospitals should have it. Has occupational therapy been in existence for long? It's been in existence for over 100 years. So occupational therapy is the way to go.
Okay, that's to say I'll find an occupational therapist in the hospital.
Yes, you should find an occupational therapist in every hospital, like I said, because people come to a hospital, the occupational therapist works in 3 areas. That's why I said you should find occupational therapists in every hospital. We work in physical disabilities. What are physical disabilities? Physical disabilities are when people have stroke, CVA, when people have traumatic brain injury, when people have spinal cord injury, when people are brought in from accidents, trauma, that has incapacitated their lives, when people have fracture, be it knee fracture, be it hip fracture, be it hand, be it shoulder, be it elbow, be it wrist. The occupational therapy, that's physical disabilities, be it neuro, in the neuro department.
Okay.
Then the occupational therapist also works in the psychiatric setting for individuals who have schizophrenia, individuals who have bipolar disorder, individuals who through substance induced, individuals who have taken cocaine, young students in universities who smoke Indian hemp, cocaine, and then start to exhibit the tendencies of maladaptive behaviors. The occupational therapist is also present there. And then the occupational therapist also works with children, children who have mental disorder, you know, children who have cerebral palsy, children who have autism, children who have Down syndrome. So when you have special schools that cater for children with disorders, be it mental retardation, be it mental disorder, you should also have a registered occupational therapist in the facility. But most times we don't have occupational therapists in the facilities. The owners of the facilities tend to use the hands that are available to them. So
okay.
those are the three areas. Those are the three areas where the occupational therapist works. Yes.
So why do I need an occupational therapist?
The occupational therapist looks at a human being in three perspectives. We look at self-care. Self-care, very important, because when you wake up, after you say your prayers, you have to brush your teeth, you have to take your bath, you have to cream yourself, you have to do your makeup. If you are a man, you have to put on your tie, you have to put on your belt, look nice. That's self-care. We look at work. What do you do that occupies you? As an adult, we go to work 8 hours. For children, work for children is play.
Okay.
So for adults, is work. For students, is going to school. That's work. Then we look at the third thing, which is leisure. What do you do for leisure? Some people watch television for leisure. Some go to the movies. Some like socializing. They like going to parties. They like dancing. Some just like to visit friends, sporting. Some play golf. Some play baseball. Some play table tennis. That's leisure. So in occupational therapy, we believe that an individual should be able to function within these three areas that I've told you: self-care, work, and leisure. When one is missing, then there is a disorder. If you can bathe yourself, you can dress up yourself, you look good, your breath doesn't smell, your body, you do not have a body odor, and you do not have a job, you have leisure. What happens? The person would exhibit some cycle. After a very long time, there'll be depression. Oh, I can't meet milestones. Because in life, we are raised to meet milestones. Your parents send you to school. When you graduate from school, you look for a spouse to marry. You marry, you have a child, you start to build your house where you and your husband will live. You build your house, then you start to see your children grow up, you start to see your grandchildren, and you become a grandparent. Those stages are milestones. When individuals are able to attain those milestones, then there's a psychosocial disorder. So within those three areas, ADLs, that's self-care, work, and leisure. If one is absent, then the person would need some amount of rehabilitation, occupational therapy, some amount of psychiatric help. If you are able to dress yourself, you have work, you don't have leisure. Let's say you go to work and you spend 18 hours in your job, 20 hours in your job, your family does not get to see you, you don't have a family relationship, you don't have a home relationship, you are not able to do things for yourself because you do not have leisure. After an extended an extended length of time preoccupied with just doing your ADLs and your work, you are bound to break down. And when you break down, you will definitely need an occupational therapist. But occupational therapists right now in Nigeria are only used in the psychiatric setting. They were first of all used in psychiatric settings in Nigeria. So if you go to all the federal medical centers in Nigeria, you are bound to find a department of occupational therapy. Okay. It's just in the last 25 years that you have now started to see occupational therapy services in teaching hospitals, in state hospitals. We are hoping that as time goes on, we start to see them in private clinic. Remember, I always say this on this show, that when you go to a hospital and you get to the hospital and the doctor is supposed to see you, you are supposed to see a team of health professionals.
You know, before you come to that now, I was going to ask you, do I get up from my house and say I'm going to see an occupational therapist, or a doctor recommends an occupational therapist for me?
If you have a child that has mental retardation, let me start from that side. You have a child that has mental retardation. You have a child that has cerebral palsy. You have a child that has Down syndrome. You should seek out an occupational therapist from when the child is 6 months or 3 months old, because those signs are present. It is not a doctor you will see. When a parent is nursing a child and you tend to breastfeed the child, if you are breastfeeding the child should reach out. If I'm wearing long earrings, the child should reach out for my earrings. Yeah. The child should want to touch my clothing in here. The child should want to touch my mouth. The child should, but when you're breastfeeding a child and the child does not have those movements,
it's just there.
Just there. You do not need a doctor to tell you, because the occupational therapy profession, we are trained to evaluate, we are trained to assess, we are trained to do treatment implementation. You see the doctor if the child has catarrh, if the child has cough, if the child has running stomach. That's for the child. For an adult, you have CVA. You are supposed to see the doctor first. That's stroke. You are supposed to see the doctor first so that the doctor does the surgery. See the doctor first. I mean, when you get to the hospital, the doctor will come and diagnose what you have.
Yeah.
But because we work as a health team, when the person arrives at the hospital, the health team is supposed to be there to diagnose. Each individual profession is supposed to diagnose the patient. I'm able to evaluate a patient. I'm supposed to do my evaluation and know that now the patient needs to go to surgery. When the patient comes out of surgery, the patient probably has a right CVA or a left CVA stroke. The patient cannot move his left side. If it's the right CVA, cannot move his left side. If the left CVA, cannot move his right side. I know that that extremity is very weak. There's hemiparesis, that's what we call it. It's very weak. I know that there's no movement on that side. I know that I will not be sitting the person after surgery. I'm just going to be doing range of, what we call range of motion, which we have in passive and active. Active is when you move your hand by yourself against gravity. That's active range of motion.
Okay.
Passive range of motion is when somebody moves the hand for you. So for somebody that has stroke, I should already be there to have done my evaluation. And after surgery with the medical doctor, I should be there, not 3 months after. I should be there to move those joints. Remember, there's no movement on one side of the body. I should be there to move the joints. If it's the wrist, I should be there to move the wrist. If it's the elbow, I should be there to move the elbow. If the elbow cannot go this way or cannot do, this is what we call pronation and supination. This is what allows you to bring the cup to your mouth. If you cannot turn your hand this way, pronate and supinate your hand, you cannot grab your cup and bring the cup to your mouth. So those are the things that I will do when the person has just finished surgery. So families of individuals who have gone to the hospital should clamor for health professionals and clamor for occupational therapy. When health professionals come together, you will see the doctor, you will see the nurse, you will see the physiotherapist, you will see the occupational therapist, you will see the speech pathologist, you will see the laboratory scientist, you will see the pharmacist, you will see...
So it's supposed to be a teamwork.
Yes, a teamwork.
All right, in case you just joined us, the program is Healthy Living, and today we're looking at occupational therapy. We'll be right back. Please stay tuned. Okay, it's still Healthy Living right here on television, and we're looking at occupational therapy. My guest is Victoria. She is an occupational therapist. Now, if it's supposed to be a teamwork with everyone around, and if it's something I'm supposed to leave my house and say, okay, I'm going to see an occupational therapist, would you say it's like that, being that you are in the profession?
Will I say that's what is going on now?
Yeah, well, what's obtainable right now in Nigeria?
No, it is not, because a lot of people do not even know what occupational therapy is all about. A lot of people just say physio, physio, physio. They just understand that a physiotherapist is supposed to come to the house and see the person maybe 6 months or 3 months after injury. But in my training, the way I was taught, you have to be by the patient within, rehabilitation is at its best within the first 3 months of the injury. Right now, people are not aware of occupational therapy. You can remember 2 years ago, we had a World Occupational in Benin, where we sensitized every person. We went to all the television stations and all the radio stations. We talked about occupational therapy. But parents with children with disability have come to know that occupational therapy is a vital part of rehabilitation, because you want to bring those children from, you want to close the gap with those children with disability and normal children. And the only way you can close this gap so that they can function, remember we are talking about functioning, whether you can put on your clothes and attain a 180 degrees joints to be able to put on your clothes, or you can do it at 90 degrees level. You know, the main goal for an occupational therapist is for you to be able to dress yourself, for you to be able to brush your teeth, for you to be able to do the things that everybody do. Because when you are able to do the things that people do, that we do every day and we take for granted, when you're able to do it, then you can function. Okay,
well, don't forget that you can always watch this episode on our YouTube channel at www.youtube.com/ITV-Radio-NG. Now let's look at the training, because you've been using medical terms, and for a second someone will want to, is she a medical doctor or what? So how is the training like?
I'm not a medical doctor, and I did not go to school to train as a medical doctor. I trained as an occupational therapist. It's right now, the occupational therapy profession is a master's degree entry level worldwide. However, in Nigeria, because we've not had a lot of occupational therapists over the years, when I came back, I trained in the US. When I came back, we were just 2 occupational therapists with at least a master's degree in Nigeria. But today I can tell you that this is what, 8 years down the line. Yes, we've had a lot of young students, a lot of young men and young women who have gone to India, who have gone to Europe, who have gone to America, who have trained, who have gone to India to go and get their bachelor's degree. Because in countries like America, Canada, Australia, master's level is the entry level. But in countries like India, countries like Ghana, they still have the BSc level. We do have a BSc level here in Nigeria, but it's only one university that offers it.
Which is?
Obafemi Awolowo University. That is the only university that offers it. I'm the president of the association, Nigerian Association of Occupational Therapists. Part of my work within the last 1 year is to develop curriculums and take to universities. So we've started doing that. Bayero University Kano has accepted the curriculum from the association. The curriculum right now is at the college board. University of Benin is still wobbling in its acceptance of the curriculum. Not that there's anything wrong with the curriculum. Their issue is manpower. Show us the occupational therapists that have master's degree level that will be able to train, that will be able to train the BSc levels. We're getting there. With the University of Benin, I'm hoping that by 2016, 2017, we will start to have graduates with master's degree level. Remember, we are 2, I told you. My colleague, my senior colleague, who also has a master's degree level, she's at Obafemi Awolowo University, and she's the only one. I work here, I work at Central Hospital, you know, so I would not leave my job to go to Obafemi.
So why
we are clamoring for more universities to take them on. If University of Benin today is ready to take up the profession, then there are a lot of BSc holders who have come, who in the 2 years that they will be employed as graduate assistants in University of Benin. University of Benin they will be able to do their master's degree in any of the sciences and be ready as professors, as lecturers for the program.
Okay, so what's the requirement?
Science, you have to have 5 credits, which include physics, chemistry, biology, you know. Then you have to have your English, maths. You have to take some other classes, but 5 credits, and they have to be credits. We do not take passes in them, which is biology, physics, and chemistry, your English and maths. And that is essential because we are in class with medical doctors. Okay. We are in class with pharmacists. Because the first 2 years of study, we actually do human anatomy, you know, because you need to be able to understand what bones, the bones that are in the body. You need to be able to understand the muscles that cover up these bones. So if somebody tells you, oh, I have an issue now, I can't pick up the cup to drink water, you want to know whether it's the wrist that the person has problem, there's an injury in the wrist, you want to work with it, whether it's the MC, the caps, the MC cap, the IP caps that there's problem, there's problem, the MCPs that there's problem. You want to know what is the problem. Then when you know which muscles is damaged or strained, then you start to retrain. Remember, what we do is the act of science of getting somebody to do what they usually do all the time, and they have not done. It's not getting people jobs. Because when people say occupational therapy, they say, oh, you people are the therapists who help somebody to find. We do that, but that's not the main crop of occupational therapy. So you look at the muscle. So we're in school, we're in class with medical doctors. It's at the 3rd year level that everybody now goes to their different major. Yes, and specialize. And then you start to learn what occupational therapy is all about. You start to learn the history of occupational therapy when it started. You start to understand the frames of reference that guide treatment. Because these frames of reference is not just about telling somebody